In this video, I would be talking about fixed dose drug combination. The overview of this presentation will include the definition of FDCs, characteristics of FDCs, the clinical conditions where FDCs are commonly used, rationality of use of FDCs in various clinical conditions, the advantages and drawbacks of fixed dose drug combinations. Definition of fixed dose drug combination or FDCs. FDCs can be defined as products containing one or more active ingredients in a single dosage form in a fixed dose ratio used for a particular indication. This does not mean concomitant therapy where several drugs are used separately, for example in infections, cancer, hypertension and so on. Next, what are the characteristics of fixed dose drug combinations? The individual drug components that are combined in fixed dose combinations have approximately equal T-halves. They also have equal apparent volume of distribution. This results in less fluctuations in the plasma concentration of the drug at steady state. For example, amoxicillin combined with clavulanic acid is an example of fixed dose drug combination. Here, amoxicillin and clavulanic acid have similar half-life and volume of distribution. Fixed dose drug combination may include two drugs, for example, amoxicillin and clavulanic acid. It may include three drugs, for example, isoniazid, pyrazinamide and rifampicin. It can also include four drugs, for example, isoniazid, rifampicin, pyrazinamide and ethambutol. Which are the clinical conditions where FDCs are commonly used? FDCs are commonly used in the treatment of HIV or AIDS, malaria, tuberculosis, etc. Coming to the rationality. What is the rationale for the use of glimepiride and metformin for the management of type 2 diabetes mellitus? Glimepiride stimulates the release of insulin from functioning pancreatic beta cells, whereas metformin acts as an insulin sensitizer. It facilitates the uptake of glucose into the adipose tissue and skeletal muscle, thereby help in lowering the fasting and post-meal blood sugar levels. Second example, the use of amlodipine and metoprolol for the treatment of hypertension. Amlodipine is a calcium channel blocker. It acts specifically on the blood vessels, relaxing the blood vessels and decreasing the peripheral vascular resistance and causing a fall in blood pressure. A fall in blood pressure decreases the activation of the baroreceptors, thus resulting in increased sympathetic activation and tachycardia. Beta blocker, which is combined with calcium channel blocker, acts specifically on the heart muscles and helps to control the tachycardia caused by amlodipine, which is a calcium channel blocker. However, beta blocker, by blocking the beta 1 receptors of the heart, decreases the contractility and cardiac output, and by blocking the beta 2 receptors of the blood vessels causes peripheral vasospasm. So amlodipine, which is a calcium channel blocker, helps to compensate the peripheral vasospasm and drop in cardiac output caused by beta blocker. So amlodipine and metoprolol, which is a beta blocker, although the mode of action is different, the action on blood pressure is complementary. The combination helps in more effective lowering of blood pressure with minimization of side effects. Third example, the combination of imipenem and silastine for the treatment of bacterial infections. Imipenem is metabolized to open beta-lactam metabolite by dehydropeptidase 1 enzyme present in the luminal membrane of the proximal tubular cells. Silastine, by inhibiting the dehydropeptidase enzyme, increases the concentration of imipenem and increases the efficacy of imipenem as an antibacterial agent and is used for the treatment of various bacterial infections. Next example, the combination of lignocaine and adrenaline. Lignocaine is a local anesthetic and belongs to amide group and it has a short duration of action of 30 to 45 minutes. It is combined with adrenaline, which is a sympathomimetic agent and acts as a local vasoconstrictor. Through alpha-1 adrenergic action, it causes vasoconstriction of the blood vessels and prolongs the duration of action of lignocaine. It also slows the absorption of lignocaine and thus reduces its systemic toxicity. Adrenaline, being a vasoconstrictor, also causes bloodless field for surgery. Next example, the combination of amoxicillin and clavulanic acid. Amoxicillin is destroyed by beta-lactamase enzyme producing microorganisms, while clavulanic acid acts as a beta-lactamase enzyme inhibitor. By inhibiting the enzyme, it protects the amoxicillin from destruction by beta-lactamases. Thus, it broadens the antibacterial spectrum and prevents drug resistance. Thus, amoxicillin and clavulanic acid is combined for the treatment of various bacterial infections. Next example, the combination of ethinyl estradiol and progestogen in oral contraceptive pills. Both estrogen and progesterone act by a negative feedback mechanism and decrease the release of gonadotropin releasing hormone from hypothalamus, which causes a decrease in LH and FSH from anterior pituitary, and since there is no LH surge, there is no ovulation. Progesterone has additional effects. For example, progesterone increases the viscosity of the cervical mucus, making it thick and viscid, thus making it hostile for sperm entry. Progesterone also decreases the motility of fallopian tube, thus decreasing the transport of ovum and sperm to the ampulla of fallopian tube where fertilization takes place. They may also alter uterine endometrium so that even if an ovum is fertilized by chance, the fertilized ovum cannot be implanted. Also, progesterone counters the excessive effects of estrogen on the endometrium, thus preventing endometrial carcinoma. Thus, the combination of ethinyl estradiol and progestogen in oral contraceptive pills is a rational combination. Next example, the combination of levodopa and carbidopa for the treatment of Parkinsonism, which is a CNS disorder. Levodopa is a prodrug or inactive by itself, and it becomes active when it is converted to dopamine in presence of an enzyme, that is dopa decarboxylase enzyme. Levodopa, if given alone, gets converted into dopamine in the periphery in presence of dopa decarboxylase enzyme. Firstly, dopamine is too polar to cross the blood-brain barrier and the availability of dopamine in the brain reduces. Secondly, dopamine acts on the peripheral tissue to produce adverse effects such as anorexia, nausea, vomiting, tachycardia, decreased prolactin secretion, mental disturbances, and so on. Carbidopa is an extracerebral dopa decarboxylase inhibitor which inhibits the conversion of levodopa to dopamine in the periphery, but it does not inhibit levodopa conversion to dopamine in the brain. Thus, carbidopa, when combined with levodopa, increases the concentration of levodopa, which easily crosses the blood-brain barrier and is converted to dopamine in the brain and is available for action for the treatment of Parkinsonism. The combination of levodopa and carbidopa thus prolongs the half-life of levodopa, thus reducing the dose by 70% and provides more sustained action. The peripheral side effects are reduced such as vomiting, nausea, cardiac complications, and so on. On-off effect is minimized since dopamine level is more sustained in the brain. The improvement is also faster. Therefore, levodopa and carbidopa is a rational drug combination. Next, fixed dose combination of aluminum hydroxide and magnesium hydroxide. Aluminum hydroxide and magnesium hydroxide are orally prescribed antacids. The rationale behind the combination is magnesium hydroxide is fast acting while aluminum hydroxide is slow acting. Magnesium hydroxide has laxative action while aluminum hydroxide has constipating action. the gastric emptying is least affected because aluminum hydroxide delays it and magnesium hydroxide hastens it. Both drugs neutralize each other's side effect and produce balanced action. So this is why magnesium hydroxide and aluminum hydroxide is a rational drug combination. Some of the irrational fixed dose combinations are the combination of a mucolytic agent and an antibacterial agent. The antibacterial therapy does not require mucolytic agent. Next, the combination of an antibacterial with an anti-amoebic agent because the patient suffers from one type of dysentery and the combination increases the cost and unnecessary adverse effects and drug resistance. The combination of tetracycline, metronidazole, fluconazole and tinidazole. Patient may need only one drug and the key point here is correct diagnosis. Next, what are the advantages of FDCs? Convenience in dose schedule ensures better patient compliance. Second, enhanced effect of the combination due to synergistic action between the drugs. For example, both trimethoprim and sulfamethoxazole individually are bacteriostatic, but the combination called co-trimoxazole is bactericidal. Third, there is minimization of side effects. For example, combining carbidopa and levodopa not only reduces the dose required for levodopa but reduces the risk of peripheral side effects due to dopamine by preventing the metabolic degradation of levodopa to dopamine in the periphery. Fourth, there is decreased drug resistance when several drugs are combined together in many diseases such as HIV, malaria, tuberculosis, H. pylori infection in peptic ulcer, etc. Next, what are the disadvantages of FDCs? Since two or more drugs are combined together in a fixed dose, dose adjustments cannot be done. Therefore, it is not suitable in altered hepatic and renal function. Secondly, if the pharmacokinetic characteristics of two drugs do not match, there can be fluctuations in the plasma concentration of the component drugs at steady state, since fixed dose combinations are given at fixed intervals. Thirdly, if there is an adverse effect, it is difficult to identify one particular drug which has caused the side effect. Therefore, adverse effects cannot be ascertained from a fixed dose combination. Unnecessary addition of drugs can increase the price of medication and impose unnecessary financial burden and decrease the quality of life of consumers. Therefore, the therapeutic aim should be clear and the fixed dose combination should not be prescribed unless there is a good reason to believe that the patient needs all the drugs in the formulation and the pharmacokinetic parameters of the component drugs should match with each other. This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.